Ramadan and diabetes. This video helps provide some general dietary advice for fasting during Ramadan if you have diabetes. However, for individualised advice, please speak to your GP or diabetes team who can help you manage your diabetes through Ramadan. So what is Ramadan? Ramadan is one of the holiest months in the Islamic year. Fasting in the holy month of Ramadan is one of the 5 pillars of Islam and is considered to be compulsory for all healthy adult Muslims. The fast lasts between dawn and sunset, meaning that Muslims abstain from eating or drinking for the duration of their fast, i.e. all daylight hours. However, fasting when you have got diabetes, especially for such long periods, can be dangerous and can cause problems for your health. So what happens to your body when you fast? When you are fasting, approximately 8 hours after your last meal, your body starts to use its own energy stores to help keep its blood glucose levels normal. It does this by breaking down your liver glycogen stores and stored fats and proteins. These all break down into glucose and are released back into the bloodstream to increase your blood glucose levels to normal. These different processes allow the body to maintain a lower but significant level of glucose despite fasting. For most people, this is not harmful. However, if you have diabetes, the normal mechanisms of maintaining your blood glucose levels during fasting may be altered. This can be further affected, especially if you are taking certain tablets or insulin. You are therefore at higher risk of hypoglycemia or hypos, which is when your blood glucose levels are too low. With this year's fasts lasting up to 16 hours, the risks of hypo and dehydration occurring is high. The other thing that can happen when you are fasting is the risk of hyperglycemia or high blood glucose levels, especially after suhoor, sehri and iftar. This is because often larger meals are eaten before and after fasting and can lead to the release of lots of glucose into the bloodstream. So, should you fast in Ramadan if you have diabetes? Choosing to fast is a very personal decision. Islam does say that people with certain health conditions like diabetes are exempt from fasting, especially if they use insulin or certain other medications. This also includes pregnant women with diabetes. As discussed earlier, there is a risk of hypos, high blood glucose levels and dehydration during fasting. Additionally, for some people with diabetes, fasting can be dangerous or cause problems to your health, particularly if you have poorly controlled diabetes, or if you have a recent history of diabetic ketoacidosis or DKA, or if you have complications caused by diabetes, including chronic kidney disease or have an active foot infection. If you still do want to fast, it is important that you adequately prepare for Ramadan by discussing your diabetes with your GP or diabetes team, ideally 6 to 8 weeks before Ramadan begins. This is so that they can help you decide if it's safe to fast and help you prepare and manage your diabetes throughout Ramadan. So what about testing your blood glucose levels during the fast? For those of you who have been provided a meter by your GP or diabetes team, it's really important to regularly test your blood glucose levels during the fast so you can check you are keeping safe. Testing your blood glucose levels will not break your fast. By writing down your blood glucose levels, it can help your diabetes team to make decisions about your diabetes treatment. So what about my diabetes medications? The changes in lifestyle and eating patterns during Ramadan places patients with diabetes at risk of hypos in the day and high blood glucose levels in the night. The types of diabetes medication you normally take can also impact on this risk. Therefore, whatever type of diabetes you have, a pre-Ramadan assessment is vital if you plan to fast. We strongly recommend you always speak to your GP or diabetes team in order for them to produce an individual treatment plan, i.e. to help you make changes to your medications to help keep you safe throughout Ramadan. If you have type 1 diabetes or are pregnant and have diabetes, you may need close medical supervision from your diabetes team to fast safely. After Ramadan, you may need further follow-up with your GP or diabetes team to reassess your medications. So what types of foods will help with your diabetes at suhoor? Firstly, it's important to make sure you actually wake up to eat a meal at suhoor. It will be easier to manage your blood glucose levels through the fast if you eat just before dawn instead of at midnight, as long hours without eating can increase your risk of hypos. Try to eat starchy carbohydrates which release energy slowly, for example low GI foods. These will help keep your blood glucose more stable throughout the fast. Lower GI food includes foods such as porridge, whole grain cereal, whole grain or seeded bread, or even basmati rice. Other foods include pita bread, chapatis, or injera or semolina. Try to include more protein foods such as eggs, beans, and nuts, as these will not impact on your blood glucose levels and are absorbed more slowly. Mixing fruit with Greek-style yogurt can help reduce the GI of the fruit. Lower GI foods are often higher in fibre too, which can be helpful to avoid constipation. So what type of foods will help with your diabetes at iftar? Ramadan is about self-control and discipline. Try to eat sensibly and healthily. Eating too much fried foods and foods high in fat and sugar will make you put on weight and raise your blood glucose levels, making them more difficult to control. Try to eat moderate portion sizes. You can still enjoy dates to open your fast, but aim to only have a small portion. A portion is 2 to 3 dates. Try to have only one moderate portion of starchy carbohydrates such as bread, potatoes, sweet potatoes, whole grain couscous, noodles or pasta, as by having more than one portion or large portions can lead to higher blood glucose levels. Other starchy foods also includes things such as chapati, injera, wrap, pita bread, fufu, plantain or yam. It may be better to eat foods that are slow-releasing carbohydrates such as lentils, chickpeas, beans, pulses or fruit and vegetables, as these can be filling and have less impact on your blood glucose levels. Try to include lean protein foods such as chicken, meat, fish, beans, eggs or low-fat cheese. Include some dairy foods to help ensure you also have an adequate calcium intake. Use foods such as low-fat milk or low-fat yogurts to make milky drinks or smoothies with vegetables or a handful of berries. Including fruit and vegetables or salads throughout the evening will help achieve a good vitamin and mineral intake. If you do use oil, try to use small amounts of olive oil, vegetable oil or blended oil. Or including oily fish such as tuna, sardines or salmon is a good source of healthy fats. So what about snacks? Consider spacing your meal out so you have a moderate sized meal at iftar and then 1 to 2 small snacks before going to bed, where again you are better having slow releasing carbohydrates or low carbohydrate foods instead of sugary desserts, which will increase your blood glucose levels. Some examples of no carbohydrate foods include a handful of nuts, 1 to 2 boiled eggs or a small omelette, or vegetable sticks with 2 to 3 tablespoons of hummus, salsa or low-fat cheese spread, or half an avocado would be a portion. Examples of low carbohydrate foods include 1 portion of fruit with Greek-style yogurt or low-fat yogurt, a whole grain bread sandwich with cheese or lean chicken, or half an injera with lentil soup. So a reminder of what is a portion. A handy rough guide is, for carbohydrates, the size of your clenched fist, for fruit 1 handful, and for protein the size of your palm. For dairy, a portion of milk is a small glass or a small pot of yogurt. So what about fluids or drinks? As discussed earlier in this video, fasting can put you at risk of dehydration, especially with long hours of fasting, as can having high blood glucose levels. Adults often need between 1.5 to 3 litres of fluid each day. You may need more in warmer climates or if you have increased losses through sweating. It is best to avoid adding sugar to your drinks or having sugary drinks such as fruit juice or full sugar fizzy drinks. Instead, try to drink plenty of water or sugar-free drinks at suhoor and after iftar. Remember, milk, yogurts, soups, salad or watery fruits all count towards fluid. Try not to drink too many cups of tea or coffee as they can act as diuretics and can increase the risk of dehydration. An example of a Ramadan plate looks something like this. For suhoor, how about some scrambled egg with toast and some fruit and plain yogurt, or an omelette with 2 small chapatis. For iftar, 1 medium chapati or naan bread with chicken curry and vegetables and some fruit, or some lamb curry with naan bread served with grilled vegetables, salad, hummus and some fruit. Don't forget to finish your meal with plenty of water. Remember, it is okay to have a small treat every now and again, but try to avoid having things every single day that may be high fat or high sugar, as these may impact on your blood glucose levels and your weight in the longer term. So when should you break your fast in the day? All patients should break their fast if their blood glucose levels fall to less than 3.9, i.e. if you are having a hypo, or more than 16.6, i.e. you have a high blood glucose level. This is because, as previously discussed, in diabetes, the pathways of normal fasting can be altered, leading to increased breakdown of glycogen stores and increased protein breakdown. Therefore, this can lead to high or low blood glucose levels, which could lead to serious harm if not treated. If you break your fast due to a hypo, remember you should consume a small amount of fast-acting carbohydrate, for example, a glass of fruit juice or full sugar drink, and retest your blood glucose levels after 15 to 20 minutes. Look out for signs of high or low blood glucose levels below. So what about exercise? Or can you pray Tarawih? Intense or rigorous exercise is not recommended during fasting because it can increase your risk of hypos and increase the risk of dehydration. Light to moderate exercise that you may normally do should be okay during fasting. Tarawih can be a moderately active exercise due to the bowing, kneeling and rising for a considerable amount of time. It can increase your risk of dehydration and risk of hypos. It may be beneficial to take water and hypo treatment with you to Tarawih. Try to drink water after Tarawih too. For more detailed advice, please visit the Diabetes UK website, which is a charity dedicated to supporting people with diabetes. Or visit the Muslim Council of Britain website for their guide on Ramadan and diabetes, a guide for patients. However, if you are struggling to manage your diabetes throughout Ramadan, please speak to your diabetes team or your GP for more advice.